Right back with more Redacted VIP. Welcome back. So how much is Trump responsible for this crisis? I mean, this was so unpredictable. I don't want to be one of those people who blames Trump for everything. But Trump did dismantle the White House pandemic response team that was part of the National Security Council. A former senior director of the National Security Council's dissolved pandemic unit said its closure left the United States less prepared for the COVID-19 outbreak. Yeah, I mean, it could have been worse. The president could have disbanded the White House extremely contagious respiratory illnesses that start with a dry cough response team. A reporter, Yamiche Alcindor from PBS, asked him about it.
My first question is, you said that you don't take responsibility, but you did disband the White House pandemic office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question, because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that, because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know about the reorganization that happened at the National Security Council?
It's the administration. Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
Nasty question from PBS? That's a nasty question? I mean, I don't think so. A nastier question would have been about your divorce. He acts like his feelings were hurt by the question. And running the White House like a business, then there must have been a good reason to fire those people. Did he find like a self-checkout machine that was better at delivering coronavirus tests? Maybe he replaced those scientists with a bunch of thermometers, which are now sitting up his ass. He cut 80% of the funding from the CDC. Maybe the CDC would have had better advice for dealing with the illness than just don't get it. Just sit at home and don't get it. But Trump gets to close the borders. Wow, he must have been so excited when he found out that he could close the borders. He must have been as excited as I was when I was told I could work from home. I know this is a horrible thing happening, but I get to do what I've always dreamed of, working in the nude. And closing the borders does make sense right now, but Trump's hostility to foreigners may have hurt us in the end. Under his administration, long before the coronavirus, there's been a federal crackdown on Chinese scientists, some of whom were working on cancer research, and some were sent back to China. One who was sent back helped invent the fastest coronavirus test that could give you results in 40 minutes. Well, big deal. We can have our results back in 2 to 5 days. I like not knowing as long as I can. And thanks to the slowdown in testing, that's possible. Now there's so much blame to go around, so let's not focus too much on Trump. So why don't we have a vaccine yet? There's been illnesses that have been around, like the coronavirus. Well, the problem is demand is low. Unless pharmaceutical businesses work alongside viruses, there will be no market for it once it's cured. That's why one reason why we're already behind on creating a vaccine is because there's no market for it. Big Pharma is not interested in it. Of the 18 largest pharmaceutical companies, 15 have totally abandoned the research and development of new antibiotics and antivirals. Heart medicines, addictive tranquilizers, and treatments for male impotence are profit leaders, not the defenses against hospital infections, emergent diseases, and traditional tropical killers. Isn't it nice to know that when we're wiped out as a species, we'll be so happy with erect penises? That's going to make for some very funny looking fossils. The cyborgs will visit a museum of natural history and get to say Homo sapiens had really big dongs. You'd think having humans around would be part of their plan, but Big Pharma isn't thinking about the long term. Of course, there's a lot more to it, trials, making sure the vaccine isn't dangerous once it's available. The government has to provide incredible incentive to get these pharmaceutical companies to work for it by publicly funding drugs. And they have. Since the 2003 SARS outbreak, the United States has spent nearly $700 million of taxpayer money on coronavirus research, more than any other country. And it's possible that a vaccine will be developed with the help of public money, but it will not be available or affordable, because the government grants exclusive licenses to drug companies. These exclusive licenses allow drug companies to enjoy a monopoly and charge exorbitant prices for medical technologies developed with public funds. Also, big pharma companies like Johnson & Johnson and Pfizer are focusing less and less on research and instead acquiring smaller biotech firms with promising drug candidates that rely on public funding and spending more on strategies to inflate executive pay. They're taking all the credit for government-funded research and then saying we should pay the pharma companies because they invented these medicines we funded. It's like we're letting somebody rob us blind, and then they charge us for prescription medicine to cure our blindness. Congress made an effort to get prices to where they should be, and they tried to prevent price gouging in the relief bill. The pharmaceutical lobby got affordability protections removed from the coronavirus spending bill recently approved by Congress, which included $3 billion in federal funding for research and development of coronavirus vaccines, tests, and treatments. Why do we have this stupid system that would hold the entire population hostage to big pharma for our lives? Well, there's a misguided belief that the private sector is the primary driver of innovation and should reap all the rewards. But can you imagine, why does someone get into the business of finding a cure for cancer? Sure, money is a factor, but I think most scientists would like to show that they've discovered something beneficial to humanity. Otherwise, they're just getting paid to find creative ways to kill rats. Also, in the $8.3 billion relief bill, of which Big Pharma gets a third, none of Congress's emergency coronavirus funding goes directly to first responders for the protective gear and supplies that paramedics, firefighters, and EMTs need to safely fight the virus. The lack of preparedness may lead to stress on the first responders, the medical care workers, who will be some of the most vulnerable workers. In Italy, 20% of hospital workers contracted the virus. And while we're helping the pharmaceutical companies, we've abandoned them. In 2014, nurses striked to protest Ebola preparedness. So we may not have nurses, but we still have big pharma executives showing up for the job. I know one of them knows the Heimlich maneuver very well, and he always does it on people who aren't even choking. He's so generous. And then that's it for News on VIP.